Hi there, this is Dr. Aruna Tummala from Trinergy Health, Holistic Psychiatry Clinic in New Berlin, Wisconsin. And today I have the pleasure of asking a few questions of Dr. Neuenschwander, Dr. New as we fondly call him. Dr. New he's actually one of the speakers here at this conference. We are both at MAPS, which is the Medical Academy of Pediatrics and Special Needs. This is my first time attending this conference, and I'm already learning ton of information that I am excited to take back to my practice. Dr. New has been working in the field of autism and special needs children and adults for a long time. So he's a veteran in this, and I'm looking forward to your talk in a few minutes. So my question for you, the number one that I'm always interested is, what inspired you to go down this path? Because it's the less traveled path.
Yes, I originally went into medicine because I had two interests. One was, helping people. The other was figuring out why we got sick, how we got well. So I really thought when I went to medical school that they would teach me about how to heal people, how to heal disease. And obviously that was pretty naive because they don't teach you that in medical school.
Not anymore. Not anymore. I think maybe at one point in time. But.
So I ended up going into general surgery because it actually was, you're removing disease from somebody. Plus, I was good at it, and I just found the body fascinating. But what happens there is, you do an operation, you take out half of somebody's colon because they have cancer, and the first reasonable question somebody's going to ask you is, hey doc, what do I do so this doesn't come back?
Yes.
Right.
Yeah.
And I didn't have a good answer for them. So at that time, I was married. My first wife, she was having some health issues. We'd already done all the medical stuff I knew about, and a friend of hers said, "Oh, I had your problems. I saw an herbalist." So she, and this is before the days of the internet, that's how old I am, she pulled out this thing, we used to call it the Yellow Pages, where she looked up an herbalist. She went to see this herbalist, and I can still remember when she came back, I'd been working as a surgery resident at that time. She came home, she had this box of supplements, they were herbs and homeopathics and all that, and we're changing how we're eating, we're gonna detox, and it's just like, yeah, whatever. But she got better in like 3 or 4 weeks. These were chronic health issues that got better in 3 or 4 weeks, and it just woke me up that there's this whole world out there that I don't know anything about. They didn't teach me about it in medical school, they're not teaching me about it in residency, and that actually got me to leave my general surgery residency at University of Michigan. You don't do that, by the way, but I did, and learn homeopathy, herbal medicine, and acupuncture, and those were the tools I started with. Now, I was treating mainly adults, had a fairly successful practice by the mid-2000s, and that was when my current wife, we work in the same emergency room together, she had a friend who had a kid on the autism spectrum, and she said, oh, how's your son doing? And her friend said, oh, he's recovered. And of course, it's like, you don't recover from a psychiatric illness, right? I mean, it's something you manage, but you don't recover from it. And she said, well, what did you do? And she said, oh, we changed his diet, we did some chelation, we put him on methyl B12 shots, and she's thinking, that's all the stuff New does. And she came home and said, honey, we're saving the babies. And that's what got me into this whole thing. So I went to my first defeat.
So behind every successful man, there is a woman, is what you're saying.
On both sides, yes, absolutely. Are we allowed to talk about that anymore? I don't even know.
I can. I'm a woman.
So. Okay, good. So, but no, that's really what got me involved in autism. And the very first Defeat Autism Now conference, which was the predecessor to Dan, I went to this conference, and I have a science brain. I love biochemistry. I love figuring out how things work. And I went to that conference, and it just blew my mind. I mean, here I had been a doctor for 20 years, almost, and here these people were talking about things that I thought I knew everything about. Mitochondria? I know all about mitochondria. I didn't know anything about mitochondria. And just, that was what got me really motivated. And then when MAPS started, I had been waiting for MAPS even before they started. It took them a couple of years to get it organized. And I got involved early on, like right when they started, because you see the differences you make in these kids.
Yes, yes.
And
Yeah.
that's important.
Yeah. Now, I must say that, for us that choose to go down this path, the common theme that I'm picking up is that we start off with a personal story, and we are people that question
Right.
things a lot.
Right.
People don't like that, but we question.
Right. There's always, there's always a certain percentage of the population, regardless of the profession. There's a certain percentage of people that aren't going to necessarily take what they're taught at face value and just
Yes.
apply that endlessly. We're always going to be asking, why? What else can I do? How can I help this person in front of me?
Mm-hmm.
Right? Because it was like with my ex-wife, I had already tried what I knew and
Mm-hmm.
it didn't work. Right? But I didn't have the wherewithal to say, oh, you should try this, because I didn't know anything about it. Right?
Yeah.
And that was really the path.
And that's also about having that openness to new experience, and being open to new ideas, and at least trying before we say, oh no, that's just hogwash, that's just
Right.
grandmother's tales, and so I think that is also very important
Yes.
to have. Okay.
Yeah.
So my next question for you is, what are 3 pearls of wisdom or advice you would have to whoever's watching this?
Well, I think the most important thing is to understand what underlies chronic illness. Doesn't matter what it is. One of the biggest ones is just environmental toxicity. And we
Yes.
all need to be conscious of that, because the world has just gotten progressively more toxic, even in my lifetime. And we need to be aware of that. You want to eliminate as much of the stuff as you can out of your life. That's number 1. Number 2 is just a solid basis of good nutrition.
Yes.
Eat real food. Don't eat junk. If you're going to go out to dinner, go to a restaurant that's going to have organic, pasture-raised, these kinds of things that are important. And then the third thing is, you really want to make sure that your head's screwed on straight. And I don't mean chiropractic, I mean mentally,
Yes.
because so many issues we have are either caused or worsened by our emotional state.
So stress resilience is what
Yes.
we're talking about.
Yes.
So learning
Absolutely.
techniques with which we can
Right,
manage
whether
our
it's
stress.
exercise, it's meditation, it's prayer, it's Tai Chi, it's yoga,
Relationships.
relationships,
Yes.
whatever it is, that's super important in maintaining our health.
Yes, wonderful. I mean, I completely agree with everything that you have said. Knowing that our world seems to be going batshit, excuse my French, crazy, what gives you hope?
Well, I mean, first of all, it's people like you, people like the folks at this conference,
Yes.
and the fact that, we have more people here today than we've had in a few years. So the interest is out there, and knowing that, there's lots and lots of practitioners, not just doctors, but lots of practitioners that they're just fed up with the mainstream because it doesn't work. I mean, basically, we spend more money on medicine, we spend more money on healthcare, and we have the worst outcomes.
Yes. Yeah.
In the industrialized world, we have the worst outcomes. And there are practitioners that hate what they do because they keep doing this and they don't see their patients get better. That's not why any of us went into practice. Right?
Yeah, I think AMA is calling that moral injury and burnout. And their treatment or response for that is go for meditation retreats.
Oh, of course. More medication, that's the solution.
Yes, meditation retreat.
Oh,
I mean,
meditation.
but still,
Okay,
to me,
meditation.
that's
Okay.
kind of, not, again, it's the same phenomenon of
Yeah.
not looking at the root cause
Yeah.
as to why physicians are experiencing burnout at increasing rates
Right.
and experiencing this moral injury, rather than fixing those root problems, which demands that we look at the whole system in its entirety,
Right.
instead of that, go for this meditation
No,
retreat.
I swear, if they let doctors do what we're trained to do,
Yes.
to investigate and determine what's best for our patients, gave us the time to do that,
Yes, yeah.
that medicine would be far more fulfilling than it is for a lot of people. I mean, for
Yes.
me, I love my job. There are days when I question my sanity, when I say, why am I doing this? I could be working in an emergency room because I'm board certified in emergency medicine. I could be working in an ER, and when you leave an ER, that's it. You don't take your problems home
That
with
is
you.
true.
Now,
That
it
is true.
might not be fun while you're there, but you don't have to worry about things when you get home. Why am I doing this? And then
Because it helps you sleep at night.
it does, but it's also, I think the universe hears my call for help, and the next day everybody I see is better, right? And all you need is one of those, just one person where they've been sick for 10, 15, 20 years, and you help them get better.
Yes.
That makes it all worthwhile.
I couldn't agree more. I mean, I have to say that I've had those experiences when I question.
Right.
I mean, like you, I was working for a hospital, quit my job, and went down this path. And some days, most days, I'd sleep really well.
Yes.
Sleep like a baby.
Yes.
And but there are days when it really makes me nervous, looking at where the political climate for physicians like us has become a little difficult over the last 2 years. That's when I feel I'm on shaky ground. But same experiences. I see people getting better, and that makes it all worth it.
Absolutely.
Yes. Thank you so much. I hope you all enjoyed this conversation with Dr. New. And if you want to reach him, you can find Dr. New at your phone number. And
yes, so we have a website. It's bioenergymedicalcenter.com. So that's the name of my practice. If you Google Dr. New, you'll probably find it. And my office phone is 734-995-3200. We are in Ann Arbor, Michigan.
And I will add this information in the description of this video as well. Thank you, everyone.